In today's program, we'll be speaking with Captain Wes Fisher, commander of the Baltimore County Police Department's Vice-Narcotics section. He will educate us about the abuse of opioids and provide us with some advice for protecting our communities. Later in the show, we will talk with Detective Corporal Christine Sisk of the Baltimore County Police Department's Burglary Unit. She will discuss the topic of burglary prevention and provide us with some helpful tips to protect our homes and businesses from unwanted intruders. According to the Centers for Disease Control, the CDC, drug overdose deaths and opioid-involved deaths continue to increase in the United States. The majority of drug overdose deaths, more than 6 out of 10, involve an opioid. Since 1999, the number of overdose deaths involving opioids, include prescription opioids and heroin, have quadrupled. From the year 2000 to 2015, more than 500,000 people have died from drug overdoses. 91 Americans die every day from an opioid overdose. We now know that overdoses from prescriptions opioids are a driving factor in the 15-year increase in opioid overdose deaths. Since 1999, the amount of prescription opioids sold in the U.S. nearly quadrupled, yet there has not been an overall change in the amount of pain that Americans report. With me to discuss the problem of opioid abuse is Captain Wes Fisher. Captain Fisher, welcome to Police Report.
Good to be with you, Rob.
So you're the commander of the Vice-Narcotics section, and how long have you been the commander there?
I've been the commander of the section for approximately a year and a half now.
And how long have you been with the Baltimore County Police Department?
21 years.
Now, the opioid epidemic, as we refer to it, it's been sweeping the nation. What are opioids, first of all?
An opioid is a class of drug that is derived from the poppy plant, and it's a central nervous system depressant. It essentially acts to block the receptors in your brain from feeling pain, and it changes how the brain perceives pain. And that's what it's usually used for. Opioids are used in terms of pain management and for people who've suffered injuries or may have had surgery recently.
And how big is this problem with opioids, first of all, in Baltimore County and across the country?
So kind of starting in the wide picture, across the nation, major cities across the United States have seen an increase in both the use and abuse of opioids, as well as deaths resulting from opioid overdoses. Here on the East Coast, we've been especially hard hit, and throughout the state of Maryland. So Baltimore County is no exception in the increase we've seen in both the level of addiction, as well as the number of fatal overdoses that we've seen.
Now, for our viewers, how did this problem come about?
Initially, in probably 5 to 10 years ago, we started to see a large swing in the abuse of prescription drugs. So because of that demand, the price of prescription drugs on the street actually went up higher and higher. It caused more people to become addicted, but then those people that were addicted could no longer really afford the prescription drugs. So they've kind of shifted from prescription opiates now to more traditional heroin, as we're seeing on the street.
And how are they being introduced to these opioids? Where are they finding these things, and how are they being introduced to them?
A lot of it begins with people who are under a doctor's care and using medication for pain, but then they become addicted to the painkiller. And they're not able to wean themselves properly. And again, the drugs become expensive. A doctor may cut them off from their prescription because they've been under care for so long, or just through improper pain management. At that point, they resort to heroin on the street in many cases.
Now, what is the police department doing in terms of dealing with this problem, first of all, enforcement-wise?
So enforcement-wise, when drug use and abuse affects the quality of life in our communities, we resort to traditional law enforcement techniques. So there are many cases where we'll use undercover and detectives in a neighborhood to try to gauge the level of activity, to target those subjects in that neighborhood who are causing quality of life issues. But we also understand that this issue is not going to be solved by making arrests. So we investigate those cases, we investigate large-scale distributors operating throughout the region, but we also have gone on to other techniques, and part of that is education. we've regularly speak at community forums and public forums about the signs of addiction, how to prevent addiction, and then if you find out someone is addicted, how can you help them, what can you do? A lot of it's awareness, letting someone know the signs and symptoms and that this problem is actually out there.
And are there any other things that you guys are doing to deal with the problem?
Members of the police department, including myself, serve on the Baltimore County Drug Overdose Lethality Review Team. It's an interdisciplinary team that's led by the health department, and we look at underlying causes of heroin addiction and opioid addiction deaths and what can be done to prevent them from a systematic approach. So we look at things like what causes most overdoses and how we can prevent those. And some of the commonalities we've seen are people who were recently in a position where they couldn't use opiates, whether they were incarcerated or in some type of treatment program, or people who may have been in recovery and not used opiates for a period of time. If they relapse and fall back into addiction, that's a very high risk factor for a fatal overdose.
Now, how do you direct your resources based upon the information that you're seeing, for example, that comes out of that committee?
A lot of that has begun with some of the things we've done, like sharing information with the health department. So we identify people who are high risk because they come from one of those populations I discussed, or because we've seen non-fatal overdoses. We'll give that information to the health department to reach out to those people and those individuals and offer peer counseling and peer support to try to get them into recovery.
Now, you talked about the health department. I'm sure they're one of your partners. Who are some of the other partners and stakeholders that you're working with in this effort?
One of those is federal law enforcement. We have detectives assigned to the Vice-Narcotics section who work with federal law enforcement. And what they tend to do is target high-level violators who are bringing drugs not just into the Baltimore area, but many times into the state. And they work throughout the Baltimore metropolitan region to combat the trafficking side of it. Going back to the health department, some of the things we've also done with them is they do a great job of putting the information out there that this is a problem, and they offer a lot of the resources that help us get people into treatment. Something else that they've done is offer prescription drug drop boxes at each Baltimore County Police precinct where people can drop off their unwanted drugs. In addition to people who are prescribed medication, a large population of people get addicted to opioids by finding them in either their or other loved ones' medicine cabinets. So getting those off the street and getting those in prescription drop boxes is a step in the right direction.
So it's important for our viewers to understand if they have drugs at home, it doesn't even have to be opioids, any drugs that they want to get rid of, they're more than welcome to come to any of the Baltimore County Police precincts and drop those drugs off, and those drugs will be put in a secure location and the department will take care of them.
Absolutely. They offer a safe location to drop those drugs off 24 hours a day, 7 days a week.
What about people who have teenagers or high school kids at home? Do we see that that population is more susceptible to using these opioids?
In general, they can be at risk for any type of behavior that can be dangerous, but we have not seen a true trend in that regard yet, so we're thankful about that. But things like being vigilant about access and making sure prescription drugs are accounted for and that they are in the prescription drug drop boxes and not unattended at home is really important.
Now, what is the impact of opioid abuse, first of all, on the community overall?
Some of the things we've seen, like I mentioned earlier, the quality of life concerns. So maybe a house on a block or in a neighborhood that someone in that house may have an addiction issue, or multiple people may. That obviously causes concern in the neighborhood. It can also lead to other crimes being committed. So that's something that we tend to look out for. But in terms of family members and the quality of life in general in our county, we really want to make sure that we identify people who are, high users of drugs, people who we are going to regularly to administer drugs for reversing an overdose, and make sure they get the services that they need to get them into recovery.
And first of all, who do we see using opioids? And second of all, what types of signs and symptoms of things should our viewers be looking for?
So in terms of who is using opioids, it really can be anyone. With the issue with the medical prescription of them, it can be someone who was an amateur athlete, a weekend athlete, who suffered an injury and needed that prescription drug to kind of get back to their day-to-day functioning because of that pain medication. So we definitely have seen that, but it really truly affects all segments of the population, and it can really affect anyone here in our county. In terms of what we're doing and how we're trying to get the word out about that is the health department, again, a great partner through awareness, letting people know to be careful when you're on prescription drugs, to really monitor your use and ensure you don't get addicted to those. So that's also something we're definitely focusing on.
And what are some of the signs and symptoms our viewers need to look for if they think they have a family member that might be abusing opioids?
An opioid causes lethargy. It causes someone to be drowsy and very tired in many cases. So someone who's tired in situations they shouldn't be, someone who might fall asleep in a vehicle at an intersection or at times that just don't make sense, that can be a good sign. But there are also often indications of other underlying issues, that someone is depressed or suffering performance at work or changing their mood or attitude at home. Those can all be behaviors that indicate someone may suffer from a drug problem.
Now, the Drug Enforcement Administration and the FBI partnered to produce a video called Chasing the Dragon. It's a pretty compelling video and it's pretty hard-hitting. It can actually be found online on YouTube by our viewers if they want to go online and look at it. We took some clips from that video, from that YouTube video. Let's take a look at some clips from that.
A friend offers you something at a party or at home, or you're having a bad day and you need something to pick you up, so somebody hands you a pill and says, here, this'll help you feel better. That's how this problem always starts.
I was at a concert, and I was 15 at the time, and I was drinking a beer, so I got a possession of alcohol charge. I got put on probation, so then I couldn't smoke pot anymore. So I started to panic, and then somebody approached me and said, well, here, try this, and it was Oxycontin 80.
So I was hobbling into work, and a young lady that worked there used to be a pharmaceutical sales rep, and she had some samples of things. And she said, Katrina, have you gone to the doctor for this yet? And I said, no. So she said, well, I have these things, take one. Not more than that, go home, take one, you know. And I had a habit every night where I'd go home and have a glass of wine.
Started taking 3 at a time, and then I was taking 4 at a time, and then I started taking like 6 at a time. And then I went from taking them orally to shooting them. And that was the end.
Okay, you know, you talked me into it right here, I don't have to pay anything, sure. It doesn't even have to be a drug dealer, it could be right in your house. And next thing you know, you're hooked.
My friends in the beginning were the friends that didn't do anything, and then I met the crowd that did do stuff. You are who you hang out with. That is for sure.
These kids go into it as, I'm just gonna go to a party and hey, they're doing this over here, let me, you know, I wanna fit in, let me do it a little bit, and it's the devil. It gets you. It's, you know, it's that temptation. Hey, this is a fun party over here. It'll suck the life out of you.
All I wanted to do, if it had been in front of my face, is do it. It's not just a little pill, you know. Respect the power of that, you know, of that pill. It's just because it's a prescription, it is every bit as deadly and every bit as addictive.
I worked at a daycare, taking care of other people's kids. I drove the daycare bus. I had to take their children to school. But before I could drive their kids to school, I was in the bathroom of the daycare, crushing up pills, snorting them, so I could go about my day.
I was in my kitchen, cooking dinner, and that happened. 17 steps up, and I had no idea that when she left this house, that was gonna happen. And I spend my Sundays looking at a gray headstone in a patch of grass. Sierra came home on February 12th. Sierra died February 18th. And she got out, still calling her, still calling her. It's that powerful that you could spend 7 months clean, and being educated on nothing but how to beat it, how bad it is for you, you know, all this. And you last 6 days.
Now, Captain Fisher, that video is pretty compelling. You know, when you watch the entire video, I think it's almost probably about 48 minutes long or so online. I mean, it speaks for itself in terms of the impact that it has on society. Now, the state's attorney's office, the state's attorney Scott Schellenberger and his people, are they involved in your efforts also?
Yes, in addition to serving as members of the Overdose Lethality Review Team, they're also close partners with us. So in cases where someone who is arrested either for drug possession or other crimes that are related to that, they often encourage and make sure the court mandates drug treatment for these people to get them into recovery. So I always say that it doesn't really matter how someone ends up in recovery as long as we provide a means for that. And the state's attorney's office often does that for us. They also work as partners in some of our higher level investigations, offering us advice throughout the course of the investigation in an effort to make sure we get a solid case against a drug dealer.
Okay. And are you guys working with the medical community and pharmacies to combat this problem, and how are you doing that?
Absolutely. We have a team of detectives who are dedicated to this. So they work very closely with pharmacies. They'll provide training for pharmacists in terms of what to look for, in terms of things like forged prescriptions and bad prescriptions, or cases where someone might be overprescribed a certain drug. So they'll go into these pharmacies and maintain connections and that two-way communication. So if a pharmacist does see something suspicious, they can reach out to someone directly in the police department to look into that further. We've also, through the health department, provided training for prescribers. The vast majority of doctors understand the, I think, gravity of the situation at this point, but getting the word out there, speaking to doctors and professional associations, and letting them know the issues at play here is something we've also been involved in.
Now, we also have Narcan in the police cars, and the health department also offers Narcan training. Tell us about that.
In terms of the health department, the number of people they've trained throughout the county is incredible. They provide the training several times a year through areas throughout Baltimore County. So chances are there's a training near you that you could attend. That information is available on their website. But in terms of the police department and putting naloxone out there, so naloxone acts to counteract the effects and the impact of a heroin overdose. It reestablishes those connectors in the brain that basically make someone revive from that overdose. We have them in the vast majority of our police cars now in the county. The program started in July of 2016. So from July of 2016 through December, police administered the drug 64 times. And then so far in the first 2 months of this year, police are already up to 55 cases where they've administered it. So it's a program that's definitely out there, and that officers carry it with them and are able to provide that in a case that's necessary.
And if our viewers want to get a hold of somebody at the health department, they can call that 410-88-REACH number, or they can contact the Baltimore County Police Vice-Narcotics section at 410-887-1870 also.
Absolutely.
Now, finally, if our viewers suspect that somebody might be, selling these opioids or even doing these opioids, should they contact your office?
They can. They can report that to us anonymously through that 410-887-1870 number.
Okay. Thank you, Captain Fisher. As you can see, the problem of opioid abuse has been sweeping our nation and has impacted the Baltimore County metropolitan area, causing irreversible harm to the lives of persons who become addicted and their families. If you would like to get additional information about opioid abuse, please contact the Baltimore County Health Department at 410-88-REACH or 410-887-3224, or contact the Baltimore County Vice-Narcotics section at 410-887-1870. We'd like to thank Captain Fisher for being with us today. Thanks again. Compelling issue. Coming up next in our program, we'll be speaking with Detective Corporal Christine Siss of the Baltimore County Burglary Unit. She will discuss the topic of burglary prevention and provide us with some helpful tips to protect our homes and businesses from unwanted intruders. But first, this message.